When the news broke back in March that BC had Canada's first death from COVID-19 in a long-term care home in North Vancouver, just across the water from here, there was fear. Would BC become the epicenter of an outbreak in Canada? It could have, if it weren't for the quick and smart response from BC's provincial health officer. The New York Times calls her the top doctor who aced the coronavirus test. Dr. Bonnie Henry has barely had a day off since the beginning of 2020, and it's her decisive action and clear, calm communication that's kept BC's numbers low.
Be kind, to be calm, and to be safe. To be kind, to be calm, and to be safe.
Words many in BC live by, and words that have become so popular, there's a cottage industry of Bonnie Henry merchandise for sale, most of the proceeds going to charity. From the start of the pandemic, people connected to her intelligence and her empathy. And following her advice has saved lives. BC has lost just over 170 people to COVID-19. Ontario, which has 3 times the number of people, has had more than 15 times as many deaths. And this is not over. The virus has not vanished, and this summer is going to be another test. Dr. Bonnie Henry is with me from Victoria. Dr. Henry, when I first interviewed you in early April, there was no talk about lifting restrictions. Case numbers were still rising. Now it's almost July, and restrictions are being lifted in phases almost everywhere. And you say that this will be a unique summer. Are you nervous?
If there's one thing we've learned about this virus is that we can't underestimate it, and we have to keep our guard up. I think we've done that really well here in BC, so I'm not sure I'm nervous. I do have an underlying level of anxiety that started in January that continues. But if people continue to do what we've been able to do here in BC, and I'm focusing on making sure our public health teams are ready to do our part as well, and we've been able to do that, we will see cases, but I believe we can manage that.
You're advising people to keep their bubbles small this summer. As Canadians plan their vacations, what do you think they should aim for, not just in BC, but elsewhere in Canada too?
I think it's really important for us to take the summer, to have some time to breathe and to connect with the people that are important to us in our lives. But we also can't lose sight of the fact that this pandemic is still ongoing. So we need to find that balance. So keeping small numbers of people, where we would have the big family gathering of 100, 150, it needs to be much smaller than that this year.
Do you think it's likely that gatherings like big weddings and funerals and conventions might be too risky to hold until there's a vaccine?
Yes, I think that unfortunately is the way it's going to be for the near future. This is not forever, but definitely for the coming months into the fall, until we have either an effective treatment or a vaccine, large gatherings like that just are too risky.
You've got some power, Dr. Henry. Your calm guidance has made BC a model for the rest of the world. The New York Times, as you know, calls you the doctor who aced the coronavirus test. And now you've even told the NHL it has to abide by your rules. You're not going to compromise those rules so Vancouver can be a hub for NHL games. What's your bottom line on the NHL?
I don't know that that's the particular reason. We did have discussions through the Canucks around some of the things that I think are important. And, for me and us here in public health and the health system here, focusing on maintaining the health, making sure that we don't compromise any of the work that we've put in BC to protecting our communities here. And it's also important to make sure that any of the teams, the players that came to BC were also protected. So there is no compromise on that at all.
Let me ask you about the American border. I know it's not your job to decide whether it reopens or not, but given what you see is happening in many states, the surge in cases, would you want it to open in July?
We have had many talks with our federal counterparts about this. I do think it's important to have family reunification, and we've been supporting that. But no, opening for visitors right now is very risky for us. And I think my colleagues across Canada, we all feel quite strongly about that.
The million-dollar question right now is, will there be a second wave? What are your fears about that? And what do you think are our biggest vulnerabilities to that in Canada right now?
What I would like to see in our best case scenario is that we continue to grumble along and control things. Maybe at some point we can get it down to no cases in a couple of days, but realistically, looking at what's happened around the world, it's likely that we will see surges, we'll see small outbreaks as we have more people who are getting together. And that's why it's so important for us to keep our numbers of connections low so that we can find people quickly, that we can do the work in public health to contain it. But we need to be prepared that when respiratory season starts, we may see an uptick in both influenza and COVID, and we'll need to be able to manage that, to have the testing capacity and the contact tracing capacity. So that's what we're planning for the fall. We'll hope for the best, but as somebody has said to me, hope is not a strategy. So we need to plan for what will happen should we start getting more cases, particularly when influenza season starts.
Where did your mantra, be kind, be calm, be safe, come from?
It really was a bit of a compilation. I was trying to figure out how we could get the message across that we need to be in this together and we need to understand where other people are coming from. We are in this storm, the same storm, but we're not all in the same boat. And by supporting each other and doing what we need to do together is how we'll all get through this storm.